Okay, hello everyone. This is Mike McSherry. I'm joined today by Pete Vernon from our Hudson office and Kim Edelman from our Camp Lejeune office. And we wanted to go over our ECC COVID-19 prevention program, which was just updated. If you're not speaking, could you please mute your phone? That would be great. Thank you. You probably received the program in an email from August yesterday, and we updated it to consolidate the various instructions and guidances we've been sending out that cover both office and project sites, and also to address some regulatory activity that's been ongoing from various states across the country. So with that brief introduction, I want to turn this over to Pete Vernon, who'll be kicking it off for us. Again, if you are just joining us, and please mute your phone if you're not speaking. Thank you.
Thanks, Mike. Hope everyone is healthy out there. Yeah, we're going to try and keep this to under an hour, hopefully 45 minutes. This morning we did a dry run and Mike said, can you not go through all the symptoms? Because there's so many. But we'll just, go through the introduction, signs and symptoms, transmission, the ECC Risk Assessment, protective measures, and investigations of incidents, employee participation, information and communication, and when someone gets excluded from the workplace and how they return. So what is COVID-19? Everyone probably knows, but it's a disease caused by an infection of severe acute respiratory syndrome, coronavirus 2, which is also known as SARS-CoV-2, among other names. There's a lot of coronaviruses out there, and this one is similar to those that cause SARS, MERS, and the common cold. And now right now it's the third leading cause of death in the United States. And Mike sent me an email earlier that said that the U.S. life expectancy inched up last year in 2020 could decline by the largest amount since World War II, as COVID-19 becomes the third leading cause of death. So it's a bad one. Next. So when this all occurred in I guess March, we could agree on that date pretty much, ECC started to make workplace protective measures and put them into place. Since then, 14 states have also established workplace rules, and federal OSHA hasn't, but they are aware of it, and they are doing inspections related to COVID-19. So they're using the current enforcement tools that they have in place, even though there's not a specific standard for COVID. So what they're doing is they're targeting high-risk industries, and a lot of industries aren't used to respiratory protection use and record keeping related to that. So that's been an area that they have been focusing on. So the COVID prevention program was, like I said, started in March, but it's gone through a number of iterations, and the last one was just like Mike said a couple days ago. So the purpose of it is to prevent workplace or transmission and protect the health of our employees and our loved ones at home, because it's not just a workplace hazard. It's also a hazard at home. It's a 24/7 hazard. So it's very important. So that's the primary benefit, to make sure our people stay healthy. The secondary benefit is to keep working. I mean, we're performing essential work in many cases, and we want to continue that. Client confidence, in that our clients know that we are aware of the situation, we're staying current with it, and that we're enacting the proper procedures at the work site. Because they don't want to get it. They want to make sure that their customers are following the proper procedures. And then conformance with the hodgepodge of network of expanding regulatory action, and that changes daily. Nick? So signs and symptoms, like I mentioned earlier, there's so many. There's a wide range ranging from mild symptoms to severe illness. And the symptoms typically appear 2 to 14 days after exposure to the virus. I'm not going to go through this entire list, but one of the symptoms that's really appears to be an indicator of COVID is loss of taste and smell. So if you have a sudden loss of taste or smell, there's a very good chance that you have COVID-19. So this presentation will be available, so you can go through this list. So we don't need to go through every bullet item. Next. So there are some emergency warning signs with COVID, mostly relative to breathing. So if any of these symptoms appear in someone, make sure that they seek emergency care immediately. Like I said, trouble breathing, persistent pain or pressure in the chest. My daughter had it, and she said that she had to lay on her stomach all the time. Otherwise, the pain was excruciating. Confusion, inability to wake or stay awake, a bluish tinge on the lips or face. But again, these are not all the possible symptoms. But breathing difficulty is the primary symptom that would require immediate care. So especially if you're having breathing issues, you should call 911. They will deal with that. For lesser symptoms, you can call your PCP and just follow the instructions that they give you. One of the interesting things about COVID is that it has a lot of weird symptoms that can be chronic. They're known as long haulers. I have a neighbor who got it in March and still can't do things that he used to do physically. So there's so much unknown about this disease, but they've correlated heart muscle damage, lung damage, kidney damage, blood clotting, issues with the brain, and fatigue and mood problems. So we're so early in this virus that not all the chronic effects are known. There could be more. Next. So, those at increased risk are older individuals and people who have other underlying medical conditions. And there's a huge list here, from cancer to diabetes, to obesity, heart conditions, COPD. So in many cases, people are asymptomatic. They don't have any symptoms, but other people who are more susceptible may have conditions that may prove fatal. More conditions that may create someone to be an additional risk include asthma, blood diseases, high blood pressure, which is very common among our population, neurologic conditions such as dementia, liver disease. So there's a lot of underlying conditions that increase your susceptibility to becoming ill from COVID-19. Next. One of the interesting things about COVID is that it has indirect effects that people may often not consider or think about. And not just physical symptoms, but it's just a lifestyle or a psychological type situation. One of them, isolation. You know, people are social beings. They want to be around other people and interact. And when that's taken away, that can cause, manifestations in many areas. Just the isolation factor. And it's stressful. I mean, we've been living with this for almost a year. And the thing about stress is it can manifest itself silently so that other people may notice it before you do. That's why we all have to kind of work together and notice symptoms that others may have that could be signs that there's a mental stress situation going on with them. So we need to look out for one another. For those who are single and live alone, the lack of physical contact can also be detrimental. Because again, just like being social, people like to have physical contact, and that can be an additional factor. And so also when we work at home, our life rhythms change. And being at home all the time may make it easier to lead a more unhealthy lifestyle. So that's another stress hazard that we need to be aware of. So try to maintain as close a routine as you can before we had this pandemic. When you wake up, get dressed as if you're going to work, and just try to make it as similar as it was before, because that will help. And if you have any chronic health problems, they may get worse. And one of the things I've seen on the news lately is that people are deferring care. People who may need to go to the hospital are deferring that because they may have a fear of contracting COVID at the hospital, or that their problem is less significant than COVID patients. So that's another factor to be aware of. Next. Also, substance addictions can be worsened. Especially in a stressful situation, people may turn to things that they perceive make them feel better, but actually it'll worsen their health. Changes in sleep or eating patterns. There's been a number of reports of people who have insomnia, and they can't sleep, and it's disrupted their whole routine, as well as concentration disruption as well. So in order to try to maintain some contact with your friends and your coworkers, try to reach out to them by phone and social media, instead of being isolated in a vacuum, so to speak, because it does help. Sadness, anger, or frustration because your friends or loved ones have fears of getting the disease from you, even though you are cleared to be around others. That may be a case. I know my daughter had that. She got it, so she has antibodies, but no one knows how long they last. And she's nervous that she may give it to someone, because the antibodies, may not be sufficient to prevent her from being contagious again. So guilt about not being able to perform normal work or parenting duties while you have COVID. It just disrupts so many aspects of family life, especially if you live, with a spouse, children, etc. It affects everything. And also, people worry about getting reinfected. No one knows about that. There have been cases where people have been reinfected after they've had the disease and thought everything was fine and they were immune, like you mentioned about my daughter. So if you feel like you need any assistance with mental health care, contact your health insurance company. There's many programs they have to help you with this area. Next.
Okay, this is Mike again. I'm going to talk a little bit about how the virus spreads and what our particular risk profile looks like at ECC. First of all, we know that it's person to person, and the transmissibility is somewhere between the flu and something that like the measles, which is kind of crazy. This relates to that R naught factor you might have heard about, where maybe the flu, a person infected with flu may, on average infect 1 to 1.5 other people. Right now, the thinking is that COVID has an R factor of about 2, maybe a little bit more, whereas the measles, it's about 16. So it's certainly not as infectious as the measles, but it does cause serious disease. So, but it's more infectious than the flu. And how is it infectious? Most of us would pick it up by being exposed to respiratory droplets of other people, cough, sneeze, singing, talking loud, breathing. These respiratory droplets are pretty large size, and they tend to drop out of the air pretty quickly. And that's the basis of the 6 feet, which we drill into everybody all the time, is that within 6 feet, most of these large droplets that contain the virus particles drop out of the airstream. You may have heard, hey, they can, project as far as 12 feet, and that may be true, but the majority is will drop out within about 6 feet. So that's kind of the main focus. You probably also have heard about airborne transmission by aerosol spread. And by aerosols, they're generally talking about much smaller particles, from the submicron to maybe 10 micron particle size and range. And these particles will stay suspended in the air for a much longer time, and as such can be transported a much larger distance. How infectious these particles are is not really known, but there is some belief that this is what's involved in some of these super spreader events with large gatherings, or more likely indoors with poor ventilation systems. So we've heard of case studies where people in restaurants that were not seated very close to others contracted the coronavirus, and they couldn't find any other sources. And that's why there's some concern about these aerosols, especially indoors. So, that's just something to be aware of. It's a potential transmission vehicle, but certainly not as prevalent as the respiratory droplets. Another source could be contact with contaminated surface. So an infectious person, sneezes, coughs, whatever, spreads the droplets on surfaces that we might touch with our hands, and then touch our face and maybe provide a pathway into the respiratory system that way, or through the eye, But again, it's a potential transmission mode. It's a concern, but it's much less than the respiratory droplets. So when Kim talks about, what our prevention strategies are going to be, obviously it's going to be focused on that, that second bullet up there with the respiratory droplets. For the most part, we're going to consider these other things and take precautions as well. But that's the main thing. The other thing I just wanted to cover briefly is the fact that a reminder to all of us that transmission can occur from people who are pre-symptomatic. They're going to get sick, but they're not sick yet, physically, overtly sick, but they carry the virus in enough quantities that their respiratory emissions can be infectious. And that's at that stage, you don't know. The person who has it doesn't know, and the people working around them don't know either. And then there's other cases that we've all heard about where people never feel sick. They're asymptomatic, so they'll go through the whole infectious cycle and never feel sick. We've had cases of people who have antibody tests that show that they've been exposed and have had the virus, been infected with the virus sometime in the past, but they can't pinpoint on it at any time when they felt any of the symptoms that Pete covered earlier. So again, that's a situation where we don't know they're infected, they don't know they're infected. So we just have to be careful about that and keep that in mind as we go through the workday. These next few slides, one of the things that we're required to do is do a risk assessment, and I kind of broke it down by working in the office, working on site, and then maybe transportation. And the fact is, I'm not going to cover all these slides, but they come right out of the program, which you've all gotten a copy of. So if you want to look at the details, look at the appendix in the program, and let me know if I missed anything. But to me, our main risk is basically dealing with each other, right? We don't treat patients. We're not healthcare workers. We're not frontline emergency responders. We don't deal directly with the public. We don't really, we don't handle bodies of COVID victims. So most of our potential exposure comes from our interactions with each other and our own behaviors. Or on the site, our interactions with subcontractors, clients. So most of the precautions that Kim is going to cover in the next segment really have to do with how we interact in these times in the offices, at the job sites, with each other. That's our biggest risk, that close contact that we mentioned earlier. Okay, and with that, I'm going to turn it over to Kim.
Okay, next slide. All right, one basic thing to remember: if you feel sick, stay home. Don't go to work and don't spread it to your workplace or around your family. So please, if you feel sick, stay home. Next slide. Okay, every day when you go to work, if you go into the office, you're going to be screened. But before you go to the office, you need to sit and ask yourself, do I feel normal? Have I been around people that may have been sick? Have I been in a high-risk situation without a mask, large crowds? Do I know someone that has been positive for COVID and I've been around them recently? So ask yourself all these things. If the answer to any of this is yes, then you need to stay home and contact your supervisor and work through the issue to determine, what the next action should be. Okay, and again, back to, if you don't feel right, don't go to work. Okay, when you get to work every day, you're going to be screened. So at the office, some offices probably have a station set up. Maybe they have an individual taking your temperature, entering information for you into an iPad. Some offices, you may have to do that yourself, where you personally screen yourself, check your temperature, answer the questions on the iPad, submit the responses, and you'll get a response back from the iPad that will say either you're okay or you're denied access. And if you're denied access because you've answered a question where you may be at risk, then you need to stop and contact your supervisor, leave work and contact your supervisor. The other thing to remember too that's really important is if you are doing your own screening, make sure that you're sanitizing anything that you've touched. So make sure that there are wipes, maybe spray, paper towels, whatever, at the area where you have to do your screening, where you can actually clean everything off for the next person. If you have someone that is screening you, make sure you're wearing your mask and maintaining distance as much as possible as you're going through that screening. This also applies to visitors and cleaning services that may be in routinely, but maybe not every day. Next slide. Okay, job site screenings. If you're at a project site, whether it be outdoors, office trailers, whatever, we need to make sure we're screening everyone as well. And basically the same principles. Taking temperatures, going through the questions, making sure we don't have anyone that is maybe exhibiting symptoms. The key thing on job sites is to remember that we need to keep our groups small as we're creating these screening stations or however you're screening your workers. So keep it less than 10 people. Maintain 6 feet of separation. Wear masks if you're indoors. If you're outdoors and you can't maintain the 6 feet, make sure you're wearing a mask. Have one person record answers rather than passing iPads or notepads or the temperature gauges around. Have one person do that to minimize contact. In the event that we do have someone that has been noted as being at risk, then again, we're going to isolate that person and get in touch with the safety manager, their supervisor, and HR for further investigation and action. Next slide. Okay, distancing. This is the best way to prevent exposure. If you can work at home, that's most important. If you don't need to go to an office, if you don't need to go to a job site, and you can stay home isolated from everyone, boy, that sounds awful. But if you can stay home away from people, then that's the best thing to do. We want to maintain our at-home work whenever possible. Use all the electronic devices you can use. Use, virtual meetings, Teams, all those things. Set up meetings that way. If you have the cameras, use the cameras. That gives you a little bit better contact, visual with the person you're talking to. So it's not as good, but it's similar. Use those things to your advantage. Keep others from congregating, limit meetings if you do have to go into the office or if you are on a job site. Limit the meetings, keep them outdoors if you can, and 10 people max. And again, wear your masks and maintain social distancing. Some other things you can do if you're working in the same areas or have to do work in the same areas, maybe stagger shifts, maybe rotate schedules, something like that. But there are a lot of different things you can do. The key to remember is that we want to minimize contact and we want to keep people separated. And again, if you have to be close, wear your masks, especially outside. If you're going to be indoors, you need to wear a mask. And make sure you're sanitizing any common surfaces that you may be touching. Next. Site vehicles. This is another one that's a little bit of an issue. We need to make sure that we're maintaining distances and keeping people safe in site vehicles. We have a tendency to get into a truck and kind of ride together over to go look at something. We need to be careful with that. If you've got a single cab, then one person max and that's it, no more. If you've got a crew cab or a van or something like that where you have more space, we still want to avoid it, but if we have to put people into a vehicle together, we want to do our best to maintain distances. We need to make sure we're wearing masks. We need to make sure that people are sitting diagonal from each other at the farthest point they can be from the other individual in the car. Windows open, make sure that we're cleaning and disinfecting surfaces as much as possible. And if you use vehicles, like one vehicle for several people, we've got to make sure that we're sanitizing surfaces after we're finished with the vehicle so that we don't transfer anything to the next person. Next. Face coverings. This is really, really important, and I know everybody hates to wear face coverings. Maybe there are people that like it, but I don't know of any. I know that they're an issue, your glasses fog, all those things that happen, but they are incredibly important. As Mike talked about earlier, it stops the spread of the moisture in your breath, which is what carries the virus. So we need to make sure we're wearing them. If you're indoors, you need to wear your face covering. I think most states, it's a requirement if you go out into the public anyway in a building, a public building, but we need to do the same thing within our own facilities. Exception would be if you're in an enclosed office, where you can separate yourself easily, close a door, that type of thing. When you're outdoors, if you can't maintain 6 feet of separation, you need to have a face covering on. Other exceptions would be when you're eating and isolated from others, 6 foot of distance with good air circulation. If you've got a medical condition that prohibits it, if you've got other PPE that would, that makes it obsolete, or if you're conducting a task where it would create a greater hazard to wear the mask than to not wear the mask. And if that's the case, then you still need to isolate and stay away from other coworkers. Okay, next. Next slide, Mike.
Sorry.
No, you're fine. Okay, face coverings. What do you want to wear? The best thing is something that is breathable, washable, double layers or 2 or more layers of fabric, but you don't want to have it so thick with fabric that you can't breathe through it. It needs to completely cover your nose and mouth, and it should fit snugly against your face so that you don't have a lot of gaps where you're breathing outside around the mask anyway. The goal is to have everything captured within the mask. You don't want something that's hard to breathe through, for example, vinyl. You don't want anything with an exhalation valve because that's just like wearing no mask. You're still breathing and your exhalation, the moisture is still going to the person next to you, so you don't want to do that. And you want to avoid using N95 respirators or surgical masks. Gaiters can be okay, but you need to double the layers up. If they're thin and you can see through them, even with a doubled layer, then it's not okay. And they're still evaluating whether or not face shields are effective or not. So at this point, we don't want to use face shields. If there's a situation where you have no option, please get in touch with your safety person and we'll work out what we can do if it's acceptable, and we'll go from there on a case-by-case basis. Next slide. Engineering controls. Again, we want to achieve good air circulation, and we want to maximize outdoor air supply into indoor facilities. Office trailers can be a problem.
Kim,
Yes.
I'm sorry, this is August. Can I interrupt you? On the N95s, were you referring to the N95s with the relief valve or any N95?
Any when you get into fit test issues and having medically qualified, as well as the fact that there are shortages. I know now it's better, but there had been shortages in the past, and we want to allow those supplies for medical professionals and those that have to wear respirators.
Yeah. Setting the shortage issue aside for a minute, what is the technical reason that we don't recommend an N95?
Because it requires a medical evaluation. It's considered a tight-fitting respirator, and you have to have a medical evaluation, and you have to be fit tested to use it.
Okay.
So, August, this is Keith Anderson. When I worked at the hospital, the kinds that you buy that look like surgical masks that have a KN95, those can be worn because they don't require a fit test. But when people are referring to the N95s, they're actually a tight-fitting mask that you have to have a fit test similar to a regular respirator. So
Gotcha. Keith, thank you for that clarification. And I think for everyone on the call, we need to differentiate between the N95 and the KN95. So, Kim, can you comment on what is it, the KN95, if that's suitable for ECC?
The K95 is actually the Chinese version. And Mike, I don't know what to say about that.
I think it's fine. I think it's okay. I think the big thing is on the shortages for the healthcare workers, but 95s are pretty common and available. So I think they're fine for us to use.
Okay, great.
There was a period there you couldn't even get those, and I knew there was a shortage. So
yeah,
okay.
but look, again, setting the shortage issue aside, I just want everyone to understand what is ECC's recommendation and the basis for that. So I think we've answered those questions. Thank you.
All right, next slide. Okay, I think we kind of went over engineering controls already. Biggest thing here is to make sure filters are clean and changed out regularly, that we maintain the systems, the ductwork, all that stuff. And if we are in a building that we rent that we do not control, we need to make sure that we're coordinating with the building manager to ensure that the HVAC system is being maintained appropriately. Next. Cleaning and disinfection. We've touched on this already, but we need to make sure that we are regularly cleaning our workstations, any surfaces that we touch inadvertently or think we may touch. We need to make sure we're doing that. We need to make sure we have those products readily available. So if you don't have spray or wipes or whatever it is that you need, hand sanitizer, make sure you let your supervisor know to make sure that we've got enough stocked for everyone to use. Another area that a lot of us tend to forget, like we'll focus on our own workstations, our cell phones, our regular phones, our computers, keyboards, all that stuff. But door handles are something that you don't use regularly, but you go out of your office, you go out of your trailer, a lot of people do. And it's not any one person's work area, so we tend to neglect those things. So we need to make sure that we're sanitizing door handles as well, and other public, general area surfaces too. Okay, in the event that we do have a COVID case, or which means a positive individual that was at work, we need to make sure that we're isolating that area, keeping people out for optimally at least 24 hours, and then cleaning after that. Okay, and that's because the virus becomes far less active and it's safer to do that. Next slide. We want to avoid sharing tools and equipment, which we've talked about a little bit. And if we do have to share, we have to make sure we disinfect between the use if we're going to share. And again, examples, keyboards, desks. I know here at site we have some workstations that we share, construction tools, equipment, and heavy equipment. Maybe you have two different operators that run the same excavator. You need to make sure you're going to sanitize that before the next person gets in. Next slide. Okay, basic hand hygiene. I know we've talked about this a lot. I know it should be ingrained into everyone's head right now, but you need to make sure you're washing your hands regularly, 20 seconds. Warm water is best if you have it. If not, make sure you're using soap and use hand sanitizer. We've got hand sanitizer all over the place. I know, Lucia, I don't know how many thousands of bottles we have, but make sure you have it. If you need some, we'll ship it. But make sure you're using these things and using them regularly. Next. Okay, incident investigation. It's incredibly important that if you have symptoms, that you report that. Maybe you got a positive test result. Maybe you were in close contact with someone. It's incredibly important that you report that to your supervisor so that we can manage it, because what we don't want to happen is for you to unwittingly come to work or come into contact with other individuals and spread it. So once we know that you have symptoms or you've had a test or you've been in close contact, then we can take action to determine who else you may have been around, if there's a potential for transmission through the workplace, and where we can correct issues or potential problems in the future based on what happened with you. We also need to make sure that we check with contacts you may have had the 2 days prior to when you were confirmed positive or experienced symptoms or were in close contact, because like Mike talked about earlier, you can spread, you can have the virus and not know it several days before you may actually experience symptoms. So we want to try to minimize potential infection to other people. And in some cases, we may need to get tests for you, or just monitor. But again, it's a case-by-case basis, and we'll determine that based on your situation. Next slide. Employees, what can you do? We really need to all be active in this. We need to make sure we understand the rules that are in place for our work environment. And if you have questions, ask questions. And if you don't understand something, let us know. Go to your supervisor, go to me, Mike, Pete, HR, get your questions answered. If there's something that we're missing that we didn't cover, let us know. We'll get through that. We'll make sure everyone else knows as well, because if we miss something in your work area, chances are good that it was missed in another work area as well. And we want to share that because we want to get better. If there's a hazard or something that you see that you have a corrective measure for or something better, let us know. And again, most importantly, lead by example. Like I said, I know some of this is difficult. I know people don't like to wear masks, but we need to do it, and we need to accept the fact that we need to do it because we're protecting ourselves as well as others. So we need to make sure we're following the rules. And if we have someone that's not quite sure or that isn't, just remind them that it's important that they follow the rules as well. And again, contact information below for Mike, Tiffany, and HR, or the hotline as well. Next slide. Communication and information. Mike sent out, and August also sent a message out about with the new prevention plan. So make sure that you've actually printed those off, look them over, make sure that they're posted in your work areas, and make sure you know what's in that. You want to make sure that you understand what's in it and why we're doing things, and make sure that you're covering this stuff. Talk about it. Talk about it in tailgate meetings. Talk about it during orientations, all hands messages. And I think we do a decent job of that. I see a lot of messages. I know we talk about it on site, but I see a lot of communications throughout the company about it. So we need to keep that up, and we need to keep everybody on their toes, because when you let your guard down, that's when we have a problem. So next slide. And again, to reiterate, employees, if someone starts to feel sick or has a sudden symptom appear, please report it to your supervisor. Something, if you're in the workplace and someone's talking about it or someone's sick, we need to stop. We need to make sure that we're dealing with those situations to make sure that we're addressing it so other people don't get infected. If you've got a medical condition or some other condition that puts you at risk, because of some of the measures we have to take, or wearing a mask or whatever, let us know. We'll do our best to accommodate. And again, this information is considered confidential, and it's not something that everyone's going to know. So come talk to us, let us know, and we'll take care of the issue. So that the goal is to prevent exposure to others and to keep everybody safe. So please talk to us. Next. Okay, and what happens if we do have a positive case? We determine exposed employees, which are those that were within the presence of the infected person for more than 15 minutes over a 24-hour period within 6 feet, or someone that may have been in the same room, maybe not in close contact, but in the same work area, same room. They could be clients, they could be subcontractors, anyone. But if we know that, then we can do our investigation, obviously, and determine what actions need to be taken. And again, the exposed employees, affected employees will all be monitored and handled on a case-by-case basis. And in most cases, when someone's tested, the health department's automatically notified anyway. But if we need to notify the health department, we do that. We also notify clients, especially when we're working on bases where we could have a significant impact on the mission of the base. So, and again, we don't disclose the name of the individual. It's all kept confidential. We'll provide testing to employees that are exposed in the workplace and affected employees. And the testing is done at no cost and during work hours. Okay, so we will monitor. And again, not everybody's going to need to test, but we need to know what the situation is to determine the steps to take. So, next slide.
Okay, thanks, Kim. Hey, this is Mike again, and I'm going to talk about exclusion and return to the workplace. But before I do, I forgot to mention right from the beginning that if you have any questions and you post them on chat, we're going to hopefully have a little time for questions and answers at the end here. And we'll start with those questions on chat. You can certainly, unmute and ask a question at any time. But, I'll have Natalie go through the questions that appear in the chat box. And any that we don't get to or can't cover, we'll try to get back to you through the meeting chat, which will, remain available after the meeting. So Okay, so let's talk about exclusion. By exclusion, we mean, just you're not allowed to come to work. We using this term in place of isolation and quarantine because obviously we can't enforce you isolating at home. What we can do is just ask you not to come in. So if you can be denied entry or asked to leave under these conditions if you have a fever. Okay, don't come to work. And if you come to work with a fever, we're going to ask you to go home. If you have any of those symptoms that Pete talked about earlier, you'll be denied entry, asked to go home. And or if you have a positive test, we'll want to keep you out of the workplace if we know that. Or if you're advised to isolate by a physician or a local health authority, please let us know. And in that case, follow their advice and don't come to work. Now, in this case, so we're talking about people that are sick, maybe sick or positive. We advise you to isolate at home. Go on the CDC website. There's information there about what isolation is and how you can protect your family members or your household members while you're at home. So isolation is really important if you're sick. You don't want to expose someone else. Another reason why you can be excluded is if you had exposure to COVID-19 case. And by exposure, we mean the close contact within 6 feet for a total of 15 minutes in a 24-hour period. And that's with or without masks. That's been a question that I've been asked probably 5 times in the last 2 days. So that's and it wasn't clear before, but I want to make that clear. Even if you were wearing a mask and the person who you had contact with was wearing a mask, if you meet that 6 foot for 15 minutes, 24-hour period, that's considered close contact. And that's kind of a recognition that masks are a good protection. They're a valuable tool. They're not perfect. Okay. Now, for close contact, we'll ask employees, we'll exclude them from the workplace, but we'll also ask you to please quarantine at home. So just because you can't come to work, you shouldn't be running around to restaurants and grocery stores or whatever. You should quarantine at home, to protect others. So if you're excluded from the workplace due to one of these reasons, contact Tiffany would be your first step to find out what options are available to you as far as work from home, and your supervisor, of course, work from home or what benefits you might be entitled to. It's an ever-changing landscape here. It's different by location. It's impossible in this training session to say this is what you will have access to or be entitled to. So each situation is going to be determined on a case-by-case basis, working with HR. Okay, so how do you...
Mike, if I could interrupt for just 1 second. So the point that Mike is raising is a really important one, because I think that we have had some incidents where people have come to work, signed in, answered the questions, and really should not have come to work and should not have answered the questions the way they did answer the questions. For example, we've had some people sign in and come to work even though they've had elevated temperatures. We've had people come to work even though they've been exposed to others that have had COVID-19. And it's just a sign of complacency and being very myopic. And it's more important for me to be at my desk than to be cognizant of my need to protect others if I may have been exposed or if I have it. So please be mindful of our ability to work at home. We've been doing it for a long time, and I know people are getting tired of it, but we still need to maintain that practice of working at home whenever possible. And don't come to work just because you can. Stay home because you can. And if you have any symptoms, if you have a family member that has COVID, if you have a friend that you've been exposed to that has COVID, you should absolutely not be coming to work, because you don't know if you have the virus, and you don't know if you have the potential for spreading it to others. And we only need to watch the news every night to see that the rate of transmission is rampant. It's just unbelievable what is happening in our society. And we, as employees and owners of ECC, we need to be responsible, and we need to implement the controls that we can implement to prevent the spread within our ECC community. So, please take what Mike is saying to heart, and please work at home if you can. Only come to the office if it's really necessary. And we just have a few more months to go and get this COVID situation behind us. Please don't be a spreader. That's the end of my lecture.
Thanks, August. That was a great lecture. I really appreciate it. So getting back to the point, if you're excluded for one of those reasons from coming to work, here's the way you get back. And there's a few different scenarios I want to cover. First, let's say you had a fever or other symptoms, but between you and your personal physician, you've determined it was not COVID-19. Okay, then what we would like to see, because we have to protect everyone, is a note from your physician indicated that COVID-19 is not in the cards here. Okay, you don't necessarily have to tell us what your condition is, but we want some verification from the physician that the physician is not concerned about COVID-19 in this case. But even with that, we would ask you not to come to work until you're 24 hours past your fever without medications. We don't care what it is, if it's the flu or whatever disease you have. If you're febrile, you're going to spread it. So, that would still apply. And of course, other symptoms improving. And with that, you could come back to work. Now, the next scenario, if you had a fever or other symptoms and COVID-19 is either suspected or confirmed, then we're going to treat it like it's COVID-19. And the rules for coming back for that are at least 10 days from the onset of symptoms and 24 hours fever-free without the use of medications and symptoms improving. So all three conditions must be met for you to come back. Okay. Let me go to the next scenario here. Okay, you have no symptoms, but you have a positive test. You need to stay out for at least 10 days from the test date. Okay, and that's assuming you stayed symptom-free for those 10 days. Okay. Let's see, I think we have one more. Okay, if you're excluded due to exposure, so this would be a quarantine situation, the latest CDC guidelines is at least 10 days from your last close contact. In California, Cal OSHA says 14 days, but I think they're probably going to update that to reflect the current CDC guidelines. But you have to be symptom-free, of course. If you get sick with it those 10 days, then we start with the COVID exclusion. But here's another option the CDC recommends, that you can cut your isolation or your quarantine short to 7 days if you also have a negative test. But here's the thing, you can't really take the test until you're at least in day 5 since your last close contact. And that's because, what we spoke about before, that it may take that long for the test to be able to detect the virus in your system. If you had a contact today and you get tested tomorrow, you're going to test negative, at least from that contact. You just don't have enough virus buildup for the test to detect it, but you may later. So that's why there's like a 5-day waiting period. So, if you wait 5 days, you get a test, maybe you get a result back right away. Then you can come back after 7 days from the close contact. Okay, so just a couple closing thoughts before and we'll look at some questions on the chat. But I picked this chart off this COVID-19 healthdata.org, and what it shows. This was as of I think the 19th. These are projections of the daily death. I think Pete mentioned that the daily death numbers from COVID right now are actually more per day than cancer and heart disease combined. But as you can see here, the dotted lines are the projections out in the future. And regardless of which one you see, we could be by early January almost double the daily death rate that we're at right now, which is a little discouraging. But the red dotted line shows that if we took no precautions, if all precautions were lifted, and you can see how high that spike would be, peaking around mid-November, or I'm sorry, mid-February. The blue dotted line is with rapid vaccine rollout. So we do have vaccines. We have 2 now. The rapidity of the rollout is going to depend on supply and logistics, but at least we are rolling them out. And the green dotted line, which is the lowest one, is actually if we had universal masking going on. So that's really our biggest bang for the buck. And hopefully, if we continue and improve on our social distancing and our masking as a society, together with the vaccines, we can really turn that curve downward, which we have to be because of all the the problems that the hospitals are running into now. But the other reason I brought this out is that we're going to be dealing with this for a while. We have to be ready for that. We have to recognize it. The introduction of the vaccines here is not an open door to just let down our guard. We're going to be living with these workplace requirements and our societal mandates for a while yet. So I think we just need to steel ourselves for that reality. So I mentioned vaccines. We've all been flooded with the news, so that's a good sign. One other thing I wanted to just briefly touch on is we have another big holiday coming up. I heard today that we're going to have 85 million travelers, which is 34 million less than last year, but still quite a number. If you are traveling, please be careful. Please, I hope that everyone, enjoys the holidays as much as possible and your family and has a very, good time. But let's be sensible and let's be cautious. And the last thought I wanted to, relay is that things change. This thing has been changing since February, and it changes all the time. And this program is, somebody mentioned a living document, but our practices, everything we think about it is living. The more we learn, the more experience we get, the more medical advances we get, things are going to change, so we have to be adaptable and flexible. Again, thank you very much for attending. And with that, I'd like to ask Natalie to kind of go through the chats, and we'll spend a few minutes answering questions, and some we may not be able to get to, but we'll try to respond on the chat. So
sure, Mike. Oh, yeah. Thank you very much. So I do apologize. I have to leave at the hour, so I have a couple minutes and then I have to jet. But I will say it looks like we have a hand raised from Manjeeb. Manjeeb, do you have a question?
I actually had a comment regarding R0, the R0 that Mike was talking about. The R0 is not a fixed number. It depends on behaviors. So there's a transmissibility of any given infection, but it depends very strongly on your behaviors. And that is how long you spend with people, how far away you are, depending on the mode of transmission. And you will see that as the R naughts over the next year or two, as the researchers kind of get their hands on the data, you'll see big differences in R naughts in workspaces that are safe compared to the ones which are not. So if you want to impact the R naught for yourself and your family, do the distancing, do the hand washing, do the masking, and you will see that at the end of the day will keep you much safer. That's all I have.
Thank you, Manjeev. I do have a question here. If you get the vaccination, do you still have to wear a mask in the office? Mike, I know you probably answered that question in your last comments, but that was the question.
Yeah, I was hoping we'd start with the easy ones. I think it's too early to tell. So in the beginning, I would say definitely yes. First of all, when you get the vaccination, it will take about a week, I think, for it to become effective against the virus. And we know that the vaccine is going to have a good effect on the severity of the disease and the outcome. I think what's still kind of up in the air is whether or not it's going to give you full immunity or not to the vaccines or to the virus. So you may still carry the virus and maybe even be infectious while you're getting protection from the vaccine. I don't know that right now, and I'm not sure we know it as a society yet. So it's a little early to tell. But remember, I said things might change. So for right now, I would say our policy should be that even if you're vaccinated, wear the mask and work. We may change that if we get more comfort with what's going on.
Great. There's also another question. The iPad check-in doesn't have a category for had COVID. Is that something that we want to change?
That's a good question. And I realized that we thought about changing it actually, but I think it would be better to handle it on a case-by-case basis. Right now, we don't have that many people that have had COVID. So I'd like to keep it that way because I think, it's another way for us to interact with people that have had issues and try to understand what's going on. I don't know if that's clear, but I'm open to suggestion there, but for the time being, I'd rather just leave it as it is because we don't want to automatically say because someone answers yes that they can come into the workplace. Well, I think we need to have a conversation.
Thanks. And then I'll just end with this last one that I had. That's in the chat. What's the protocol for traveling for work or holiday and returning to the office? Is there a quarantine or testing requirement?
Not in our program, but I would advise you to check with the locality, the state and locality of where you're traveling into. Most states that have had a travel quarantine have exempted critical infrastructure workers, which would include us. Some have even excluded travel for work altogether. But again, it's changing, and it's 50 different states and different localities. So I think we need to check with the specific one.
Great. And that's all I had in the comments box. So I'll open it up to questions at this point, and then I will need to drop off. Thank you.
Natalie, before you drop off, is there someone else that will stop the recording or will it stop automatically when I end the meeting?
It should stop automatically. I believe, and correct me if I'm wrong, Ryan, if you're still on the call, it should end the recording when I end my session. So if anybody has any other questions, feel free to just type them into the comments box. Those will be recorded way past the recording, and we can answer those as we get those answers. So this recording will also be posted in Talent LMS, and I'll be giving credit to those who showed up today on the call. So just keep an eye out on that for the assignment and then the completion. So thank you.
Thanks, Natalie. Okay, are there any more questions?
I don't have well, this is an answer to a question, Mike. Several people have asked, what's the protocol for work or holiday returning to the offices? And there's a variation of that question with regards to what if you travel and you're on a plane. So I don't think there's any formal quarantine requirements coming back after the holidays. But I would say, as a general note, by and large, I would encourage anybody who can work from home. This just goes off of what August said earlier, to work from home. You know, we talk about security clearances and a need to know. Think of it as a need to go. You know, do you need to be in the office, or can you work from home? And particularly that first week back, if you have traveled or if you have been with relatives that are not normally in your bubble, I would encourage everybody to work from home if possible. And if not, maybe just be a little bit proactive about talking to your manager to find out kind of what we can expect in terms of that first week back. Because the last thing that I would want to see is, you know, we've had pretty good results thus far, not perfect, definitely some avoidable things, but I would hate to see a whole bunch of people go home for the holidays, be on airplanes, be with family who was on airplanes, and then come back in that first week of January and just get us off to a really bad start with a bunch of infections. So just plan your week of January 4th. If you don't need to be there, plan on working from home. And if you feel like you have to be there, maybe just let your manager know ahead of time so we can get in front of that.
Great, thanks